have spent at least $1 million to medical tourism in the first few months of 2023, and this is a 40% increase attributed to the mass exodus of medical professionals abroad and poor healthcare system. Amid this situation, medical experts are now calling on the government to increase its spending in the health sector to encourage more people to get treatment in the country. Thousands of Nigerians leave the country to seek medical attention abroad, mostly in India. And let's have more details of that in this report.
Silva Dakum had a health complication a few years ago and had to seek medical care abroad.
I was diagnosed of leukemia, that's cancer of the blood. So after the diagnosis, the doctors in Jude came out with two options. They advised that the safer option, I should go for bone marrow transplant.
Thousands of Nigerians leave the country to seek medical attention abroad, mostly in India. The government says the country loses between $1.2 and $1.6 billion annually to medical tourism. This is mainly attributed to the poor state of Nigeria's healthcare system and the low numbers of health personnel.
We've been having this train of doctors moving abroad to practice overseas. And as such, there are kind of like vacuums in our healthcare sectors. Our hospitals are not well equipped. We need more funds in the hospital, in the healthcare sector. And this is why one of the reasons we realized that some patients with chronic ailments have to travel to other countries just to make sure that they get their proper diagnosis and treatment done.
Experts say Nigeria's government needs to address these challenges to meet all the healthcare needs of Nigerians.
They have to prioritize in terms of how to allocate these resources appropriately. So more budgets are needed in the healthcare sector. The budgets such as to ensure the hospitals are well equipped, also to ensure that there are adequate provision of essential medications for patients as needed, and many other things that the budget will actually help.
The government promises to prioritize healthcare development for Nigerians.
Nigeria plans to raise its annual budgetary allocation to the health sector by 10% starting next year, with promises of a further increase if the money is well utilized.
That still falls short of the African Union's recommended 15%, but that could see hospitals in Nigeria become better equipped to handle cases like Silva Dakum's. Ajek Mangut, CGTN, Abuja.